Over the years, our family's had a share of health problems.
So prescriptions are a part of our life.
Before we went to the big box store.
We both thought it would help us save. But with the long lines and impersonal service, filling prescriptions became a chore. That's when a friend recommended D&H.
Now Tristan knows our prescriptions. Brenda always helps us find the right vitamins. And after Dad's fall, Monica's been a real expert with all our home medical needs. All without the lines.
Trust and service.
That's our D&H.
Good morning and welcome to Radio Friends on Thursday, December the 18th. 1 week from today is Christmas. And we have Major Richard Trimmell with the Salvation Army. Good to have you with us.
Good to be here. Thank you.
And Merry Christmas to you.
And you.
You guys are just working your boots off right now, aren't you?
Oh, I'm meeting myself, coming and going, but it's such a wonderful time of the year.
Yeah. How is the fundraising going?
We are doing well. We're right on target. Now, we'll go through the end of January, actually. Mm-hmm. But we're exactly where we should be and feeling real good and confident about it. There's just a really happiness about the giving spirit this year. I think people are a little more upbeat than I've seen them in the last year or so. Yeah. And so it's a great feeling out there.
I'm happy to hear you say that,
yeah.
Because so many organizations, so many wonderful organizations, mm-hmm. are asking for assistance because so much help is needed in our community. And to hear you say that the Salvation Army is happy with the way things are going is it lifts my spirits. You know, because the need is so great. Even though you're getting what you were hoping for, the need is greater than it was last year, isn't it?
And, you know, we've been doing this for a long time. And I think the thing I feel good about is that we've set such a track record over the years. People know who we are. They know what we do. We're very open and honest about what we do. And people kind of come alongside us. And so they support us well. And we feel good about that.
The money that people donate to the Salvation Army, Central Missouri, it stays here in Central Missouri.
Absolutely, it does stay here.
How many folks do you have off the top of your head, how many people you've helped this past year?
Well, you know, I don't have that off of the top of my head, so let me just pick out a figure. How about 1 million?
That'd be good.
It seems like that
yeah.
From time to time. But the number of folks coming to seek help is going up. And we've seen about a 20% increase in relation to the number of folks who come in for the food pantry. And of course,
you're saying a 20% increase from last year?
Mm-hmm, absolutely.
A 20% increase from last year.
Mm-hmm. And so, you know, those numbers keep going up. Of course, Harbor House is almost always full. Yeah. But I'm talking about the regular social services office where we give out assistance and do the pantry. So the numbers are going up. And the applications this year for holiday help have been up as well, and we have several different programs involved in that.
If people want to help out now, just a week before Christmas, the best thing they can do is what?
The best thing they can do at this point of the game is donate. Mm-hmm. The kettles are still out. They'll be out through Christmas Eve day, but we're still taking donations after that. They can stop by the thrift store and make a credit card donation. They can go online to tsacentralmissouri.org and they can make a credit card donation. They can drop it in the mail. They can come by the office.
There's all kinds of ways you can, that you can give.
Yeah.
So the kettles will be on the street through Christmas Eve. What is it, till 5 o'clock on Christmas Eve?
Yeah, usually we end up about 2 o'clock, but you know, we have some folks that have traditionally, that's their big family thing, is to go out and bell ring on Christmas Eve day, and they'll be out later.
But even though you pull the bell ringers off the street on after Christmas Eve, you're still you accept donations every day of the year. but if you want to help them make the goal for this year, right. It counts through the end of January. Is that right?
It does, and this gives a chance for year-end giving as well as other types of giving.
Thank you very much. Merry Christmas to you.
And you too.
Okay,
Thank you.
Salvation Army. Now we turn to Aaron Swaney. Good to have you here, Aaron. And you're here because we have open enrollment for the health insurance marketplace. and you wanted to pass along some information about what people need to do. And you're from Family Health Center,
yeah,
right?
So I work at Family Health Center, which is a federally qualified health center, which is essentially a primary care clinic here in Columbia. We're up on the corner of West and Worley in that building that used to be at Knowles years ago.
Yeah, I know exactly where it is.
And what I'm here to talk about is how people can get help getting financial assistance to buy health insurance.
Okay.
And so a few years ago, you know, this Affordable Care Act was written, which is a kind of contentious law, but what I'm here to talk about is the tool that people have to get financial help.
So how do they do that?
So, you know, everything's run through this healthcare.gov website. It's called an exchange. Essentially, you know, what they do is they look at your income, your family size, and they say, okay, you know, you aren't offered coverage through your job. You know, you don't have Medicare or Medicaid or anything, so you don't have a way to really get access to health insurance. And so what they do is they'll give you essentially a discount on getting something from a private insurance company.
Right. So what you do is you go on to the website. It's healthcare.gov, and you put in your information, your age, the number of people in your family, what your expected income is, correct?
Correct.
And then you search for insurance. You search for an insurance. It will tell you the price of that insurance, and then it will tell you what your subsidy should be.
Yeah.
So it brings the cost, the total cost of the insurance way down.
Yeah, it's kind of like what employers do with their employees, where they, you know, they're essentially paying for a large part of the employee's premium. And the big thing actually is not just the going to healthcare.gov, but actually knowing that there are places here in Columbia where you can get help.
There are places you can go to where you don't have to go on the internet yourself and do it?
Yeah. So there are 4 places here in town where you can get help. There's Family Health Center. You know, we do that.
And that's at the old Knowles location?
Old Knowles location. And then there's also Central Missouri Community Action, which is kind of across from the Hickman Baseball Stadium on Providence. And then Central Missouri Area Agency on Aging is up on the 2nd floor of the Senior Center on the Business Loop.
So all of those, what's the last location?
The last one is Primaris, which is a business over on Keene Street, kind of south of Women's and Children's Hospital.
Okay, so all of those locations you can go in, and they will help you navigate, do what you need to do.
Yeah.
And hopefully you'll walk out with information and insurance.
Yeah, well, you know, and even if you don't walk out with insurance, you at least get your questions answered. And that's, you know, that's the goal of all of our businesses is to get people.
We're out of time, but what's the phone number to call for more information?
886-6790.
886-6790. Okay, Aaron, thank you so much for coming by. Pleasure having you on today. Call that number if you want to enter 886-6790. Our program directed by Travis McMillan, Reynolds Journalism Institute. Audio is Pat Akers from KBIA. Our floor director, Lowell Thomas, and our assistant producer and guest coordinator, Uncle James Mauser. Have yourself a nice day. See you tomorrow.